HIV/AIDS until when? Many people living with HIV like me would really like to say the HIV pandemic has finished and a cure and vaccine are available. That is aspirational, it is a dream. Currently there are 39 million people living with HIV, but only 29 million have access to treatment. The World Council of Churches, WCC, became a member of the UNAIDS High-Level Panel on a Resilient and Fit-for-Purpose UNAIDS Joint Program in the context of sustainability of the HIV response. Based on more than 20 years of experience working on HIV and with an important partnership with UNAIDS, proudly, WCC represents faith communities in the panel. The following are affirmations on the sustainability of the HIV response that WCC made in its capacity as panelist. The HIV epidemic is not over. Furthermore, is not over in this moment in history in which resources for HIV have a pattern of constant reduction for the last 5 years. Yet, this is the moment that we face the real possibility of ending AIDS as a public health threat, and the possibility of ending HIV transmission. New technologies such as long-acting injectable treatment and prevention are real game changers and could secure access for the groups that nowadays are being left behind, groups in which the epidemic continues to have large impact, because of the inequalities. The responsibility of mobilizing resources for the HIV response is of all, but specifically, of the countries. There is a grave concern because several countries depend on international cooperation for medications for HIV. This means thousands of lives depend on the goodwill of some countries. Yet, it is the states that consecrated the right to health in their constitutions. Investing in treatment for people living with HIV is a responsibility of the state. It is a duty in order to protect the human capital and the right to life and to health. It is also an investment in HIV prevention because a person living with HIV who has an undetectable viral load can no longer transmit it. International solidarity has led to incredible progress in the HIV response, making it an example for other diseases. But what happened now that people are not dying anymore? International solidarity, literally, saved many people from dying. However, now that we have the possibility of living with HIV, the international space feels lonelier every time. As we renew the call for international solidarity, we acknowledge the need for radical accountability and transparency. It is important that all stakeholders demonstrate how they used the funds, what are the tangible outcomes. In any case, we are talking about the sustainability of the HIV response, not of structures. Our collective work should prioritize support for countries and grassroots communities, which are leading the response. Communities have demonstrated that they are sustainable. Communities were there before the funding, during emergencies and pandemics like COVID-19 and will remain there after the funding vanishes. Despite the crucial role of communities, the investments in its structures are minimal and inexistent in some cases. In other cases, communities are persecuted and stigmatized. There is need for a renewed narrative in HIV, one that recognizes the need for integration. The mechanisms need to be adaptable, agile, effective, and simplified. WCC recognizes and acknowledges the unique contributions of UNAIDS to global health. Among several contributions, the focus on inequalities in the HIV epidemic, the need to use human rights and gender analysis, and the importance of people-centered and community-led approaches are some of the main contributions of UNAIDS and all its co-sponsors and partners to global health. Not only governments and international actors have the responsibility of acting to ensure the sustainability of the HIV response. Faith communities have a crucial role as well. The following are some ideas of how faith communities can accompany the response, support networks of people living with HIV and become a safe space for them. Educate your congregants on HIV prevention. Join advocacy movements of multi-stakeholders and demand public budget allocations for HIV prevention and care. Reduce the inequalities that drive the HIV epidemic, for example, support girls to remain in school, reduce gender-based violence in your community, create income-generating projects for the most vulnerable groups and eradicate stigma and discrimination against people living with HIV and most affected communities.